Hi, we're just gonna give it a few more minutes to let more people join before we start.
Hello, hello.
Um, I
Where I
think
was logged in,
no worries. I think we're gonna go ahead and get started in a minute. I think most people have been admitted. Just check. Cool. One sec. Cool. So we're just going to start with a little introduction. Good afternoon, everyone, and welcome to this virtual panelist webinar with Dr. Laura Gerald. My name is Megan Etchemarty, and I am the founder of RESTEM Initiative. Thank you so much to all of you here at the webinar today, and also to those of you who are watching from the live stream platforms. Before we start, if you haven't already, please fill out the anonymous survey linked to the QR code. While you are doing that, I would like to mention that this is an interactive webinar, so please feel free to share your questions or comments in the chat, and Dr. Gerald can answer them at the end. So to begin, let me give you a little introduction to RESTEM Initiative. RESTEM Initiative stands for Rural Education STEM Initiative, and it is a registered nonprofit organization that has done work primarily in rural communities across India, as well as now in North Carolina. The mission of RESTEM Initiative is to minimize the rural to urban educational divide by enhancing STEM education for the rural community and preparing and motivating and inspiring students for real-world occupations in the STEM fields. Inadequate rural education is an issue faced at varying degrees by every nation in the world. RESTEM Initiative is working to mitigate this issue by creating hands-on STEM kits for students from rural and underserved communities, as well as organizing webinars like such. Now, without further delay, I will pass it on to Raghav and Sai from the RESTEM Initiative team, who will take over the rest of the webinar.
Thank you, Meghna. So just some background information on Dr. Gerald. Dr. Gerald was born and raised in a rural town of Lumberton, North Carolina, in Robson County. Dr. Gerald holds a bachelor's degree from Harvard and Radcliffe Colleges, a medical degree from Johns Hopkins School of Medicine, and a Master of Public Health degree from Harvard University School of Public Health. She is a board-certified pediatrician and fellow in the American Academy of Pediatrics and adjunct assistant professor at UNC Gillings School of Global Public Health. After medical school, Dr. Gerald began her career in her hometown of Lumberton, North Carolina, as a pediatrician. From there, she turned her attention to the statewide health improvement, first with Community Care of North Carolina, where she worked to improve her healthcare while also managing costs for the Medicaid population, then as the executive of the North Carolina Health and Wellness Trust Fund Commission, which awarded millions in grants statewide annually to decrease tobacco use and increase healthy eating and active living.
By 2014, Dr. Gerald was overseeing statewide health policy, serving as the North Carolina State Health Director and the Director of Division of Public Health, where she prioritized the importance of addressing social determinants of health in order to improve health outcomes across the state. She then turned her attention to a national scale while working at Evolent Health with health systems across the country who are transforming healthcare delivery on a pathway to more value-based healthcare. Dr. Laura Gerald is currently the president of the Kate B. Reynolds Charitable Trust, one of North Carolina's largest private foundations. At the trust, Dr. Gerald continues to improve the health and quality of life of vulnerable North Carolinians. Thank you for joining us today, Dr. Gerald. The first question we have is, growing up, what got you interested in biology and medicine?
Awesome. Well, first of all, thank you for having me. Thank you for that lovely introduction. And Magana, thanks so much for inviting me today. I really appreciate the invitation, and I promise I'll answer your question, but I just want everyone to know, listen, I'm very informal. So put your questions or anything that you may have in the chat. I'm happy to interrupt and answer them and not even wait until the end. I literally have no shame. I'm just here to answer any questions that folks may have. But to answer your question about my interest in biology and medicine, you heard the bio of where I went to school. I've certainly had arguably the best education someone else's money could buy. And that's really been the story of my interest. I've really just always pursued as much education as I could get. And that's from a background in Lumberton that was, like many other rural communities, fairly underserved in terms of financial resources. But we had a lot of resources in people and in teachers and community members who poured into me. So some of my first memories of educational success, if you will, were in science. And so I told the story to Magana's class at NCSSM of having a fourth grade teacher who was the first person who really made me feel like I was smart. I had struggled in math in the third grade with a substitute teacher that probably shouldn't have been teaching, but that's what we had in Lumberton. I don't even know to this day if I can do long division, but that's another story. As for the fourth grade, there was this project that we were assigned where it was like a health book that we were supposed to do. And we were supposed to like label parts of the body and you know, make up this little booklet of how to be healthy. And I really cannot draw at all. So this was an interesting assignment for me, but I took my education real seriously. And so she said, you know, the one who does the best book is going to get a prize. I'm a little bit competitive too. And so anyway, I worked real hard to be neat, even if I couldn't draw. And I won the prize for the best health booklet in the class. And now, mind you, I am talking about pretty much a segregated elementary school. So in this particular school in my neighborhood, there were a few students identified early on as being somewhat gifted. And so I was fortunate to kind of be in that group, but to be singled out as, okay, this was the best booklet, that made me feel good about myself and made me think, oh, well, maybe I can do science. Whereas I don't know that I had thought prior to that I could. I was more of a reader, an avid reader. And so fast forward to the 10th grade, when I had another teacher that took an interest in me, and that was Mrs. Blackman, my biology teacher. And we had a leaf booklet project. I don't know if any of you guys had ever had to do anything like that, but we had to go around Lumberton collecting all these different leaves and pressing them in this wooden, sort of wooden boards that we created. And I just loved that project. I loved the whole idea of leaves, or, I don't know what about that just enamored me. But when it then came time to continue to pursue my education, I did decide, like Renata and others, that I would go and apply to the North Carolina School of Science and Mathematics. And so I did do that, got in, made the decision to leave my hometown in Lumberton, primarily because I wanted to pursue as much education as I could. And there, did extra classes in genetics. I took AP biology at Math and Science with Ms. Baker. I didn't intend to like go into college as a sophomore or anything. I wasn't taking it. I don't even think I took the AP test. I just wanted to have the information and really like the class. And so that those extra classes kind of solidified my work in biology and interest in biology. I also, obviously took a lot of science, took a lot of math and other sciences at Math and Science, but biology was the most interesting to me. And so when it came time in college, once I got to Harvard, to declare a major, I literally just declared the major of what I was most interested in, which was biology. And it so happened that biology is also, the courses that you take to major in biology are the same as the pre-med requirements. And so I did not apply directly to medical school from college. I actually took a year off and took a job in healthcare consulting in New York City. I actually lived in Manhattan for a year between college and medical school. It was the time of my life. As it turned out, I gave up my 20s for medicine. So had it not been for that year in Manhattan, I would have had a very dismal decade. So I followed some advice to take that time off. I didn't have to do, extra classes in science in order to eventually apply for medical school because I'd already taken those classes. And so during that year, I ended up deciding to and applying to go to medical school. And, that's kind of a whole nother story, but basically I had very good mentors and advisors in college who helped me to see that I could go to not only medical school, but could apply to some of the best programs in the country. I thought that if I went to medical school, I would, come back to North Carolina at that time, but ended up applying to and getting admitted to Harvard and Hopkins and a number of medical schools and decided to go to Hopkins since I'd already been at Harvard. So that's kind of the path to biology and medicine.
Yeah. So just like a follow-up question to that, I know you talked about your educational experiences. Obviously, going to schools like Harvard, Johns Hopkins, those are pretty big accomplishments. But would you say that you ever felt that there was like a moment where you felt like that was like the biggest challenge for you, where you felt challenged in some sort of way along that path?
This is a very good question. And a lot of people I would think do kind of wonder, how do you go from Lumberton to Harvard? And it is not something that everyone does. I will admit that it is not terribly common in my community, but I didn't know that Harvard was not accessible to me, because the story for me is not the same as a lot of people from rural underserved areas. I was not the first in my family to go to college. I was not even the first in my family to go to Harvard. So I grew up in a family that was educated. To my grandparents, my uncles and aunts were educated. They were educators and things of that nature. So we have valued education as a family historically. Black people in Lumberton couldn't get an education back in the day, and my grandfather and family members and others helped to start a school, you know, for K through 12. So Black people could be educated. So we have always, as a family, valued education. And I was born in Lumberton, grew up in Lumberton, but briefly, my family moved to Philadelphia to follow my father, who had gotten a job in Philadelphia as a pipe fitter, a job that was at that time reserved primarily for white men. But he had done so well at a test that he qualified for this job. And so we moved to Philadelphia briefly. And my oldest brother went to school in Philadelphia at Albany High School. And my father ended up passing away. I was at the age of 3. And I just turned 3. My oldest brother was like 14, actually, he was like 16 when my father passed. And so my mom wanted to get back to Lumberton. She had 4 children. She wanted to get back to Lumberton. So she had my oldest brother skip the 11th grade and go straight to the 12th grade from the 10th. And his guidance counselor at Albany just encouraged him to apply to Harvard. And he ended up going there in part on a scholarship for the Sons of Widows. So it just goes to show you how things just kind of work out in crazy ways. He couldn't, of course, afford Harvard, but he went. And from there, several of the rest of us went. My next brother then went to Harvard. And I never visited when my oldest brother was there, but I did go to my next brother's graduation. And when I saw the school, I was like, okay, this looks like a pretty good school. I guess I can go here. And so I just really didn't know that that was not something that was common. By the way, my sister went to a UNC school. It's not like we were against UNC schools. She probably is the most successful out of all of us. But anyway, you know, and going to Harvard was interesting from math and science. Now, if I had gone directly from Lumberton to Harvard, I'm not quite sure what my experience would have been. But I went to School of Math and Science from Lumberton and spent my last 2 years there in an environment with a lot of other students who were smart. So to make a long story short, when I got to Harvard, I was not thrown off by being around super smart people, many of them valedictorians. So that really threw off some people, particularly in pre-med, because suddenly you were seeing the mean, whereas you had been accustomed to doing very well. And so, to be honest, a number of my classmates, you know, took Chem 1, took, you know, Math 2, and got all flustered and quit pre-med and went into, you know, econ and sociology and stuff like that. But I was by that time used to seeing the mean, and I just kept rolling. And so my academic experience at Harvard was fine. I mean, you know, I enjoyed it. And I think what I liked about it was, you know, everything was like top notch. And even to this day, you know, there are classes that I took in college that I still draw upon, class in justice with Michael Sandel, and classes in, you know, Chinese Revolution and women's studies and Black women writers, civil rights movement. I really enjoyed taking a lot of the liberal arts kind of things because I had been so inundated in science and math. And so I had a really good undergraduate experience. I will say, to this day, the fall just brings a little, you know, excitement in me thinking about going back and, you know, going to the Yard and Harvard Yard and Harvard Square. And there is a magic about a liberal arts kind of education and just everyone being there to study that. You know, I can't think of any place where that was reproduced Med school, different story. Note to self, no need to, I mean, I wanted to really push myself in med school, and that's why I went to Hopkins. They were known as being very sort of hardcore. And that's definitely what I got. That was when I sort of hit a wall and was like, oh my God, this is hard. I better really study. And, you know, long story short, I took my anatomy class, and that's the first time I had ever stayed up all night to study for a test. This is a true story. I stayed up all night to study for my first anatomy test. I hallucinated during half that test. I don't know what happened. I blacked out for a period of time. I made it to C in anatomy. I got through it, but I made it to C in anatomy. And I told myself then two things. I will never stay up all night before a test again. I never did. I always went to sleep at least at 4 o'clock, woke up at 6. And I said to myself, I have to study every single day. And I studied every day, including Christmas in medical school. True story. But at least it was just for 2 years. We had last 2 years for clinicals, so I didn't have to study every day in clinicals. That was maybe more than you wanted, but that's the answer to that question.
Yeah, so that was very interesting. So I know you went through like a lot to get into Harvard and then Johns Hopkins, but like while you were growing up, or you know, during your upbringing, did you ever like notice any inequities in access to healthcare? Like, and how have you been addressing these kinds of issues with your endeavors?
That's a really good question. And I don't know that I would have identified them as inequities, but there were things that I noticed growing up. So in my community, we had one doctor, Dr. Robinson, older Black gentleman. And when we were younger, we all went to Dr. Robinson. He literally, his like house was his office. And mom, kids, you know, everybody kind of went to this one doctor who generally, in my memory, you know, gave everybody a shot. So you knew, oh my God, I'm going to Dr. Robinson, I'm going to get a shot. And so nobody wanted to go. But that was my access to healthcare. You know, the guy in the neighborhood who opened up his house to see us. Now, as I got older, I went to a clinic, a legitimate sort of clinic. It was on the other side of town, you know, across the railroad tracks. And what we knew growing up, and the stories that we told in our community, were because we were on the side of the railroad tracks, that was not where the hospital was, that people died because trains would come and people wouldn't be able to get across the railroad tracks to get to the hospital. So, you know, there's stories of people going under the train or under the track somehow to kind of get to the doctor's office. So again, I'm not calling these inequities. I'm not asking why are all the Black people living in this part of town that's like separated from the hospital. But that was just what we knew. I mean, it was just, oh, well, you know, if you want to go to the doctor, you gotta hope the train's not in the way. And so at first we didn't go on the other side of town for medicine. We went to Dr. Robinson, but then we went and, you know, I went to a clinic and I really didn't think any more of it. But I do know too that my dad died when I was like 2 going on 3, 2 to 3. I just turned 3. And the story about that was he went to the hospital on a Friday and it died by Sunday. And we don't really know what happened or, you know, how he came to be that ill, if he had any care. So I guess I had these stories of healthcare that wasn't really working for not only my people, my neighborhood, my community, but for my own family. And so that may have had something to do, you know, with why I went into medical school or why I went into medical training, but I just don't know that I was truly that conscious of it. By the time I got into medical training, the other disparity that I noticed was it was about that time in my life, my late 20s, that actually, or early 20s, I realized I was poor or from a neighborhood that was considered poor. I realized that my community was considered medically underserved and was on the National Health Service Corps list for medical manpower shortage. And so I talked to my pediatrician at that same clinic across town where I used to go for several hours as a resident, and realized just how much need there was in Lumberton for doctors. And so that is when I decided, okay, I am going to not only devote my life to medicine, healthcare, this thing that hasn't worked for us, but I'm specifically going to go back to Lumberton and practice medicine, even though I hadn't really intended to do that, going to Harvard and Hopkins and all that kind of stuff. But ended up going back and practicing in that same clinic that I went to before, going off to college with my pediatrician from when I was a little girl, and there my eyes started to open, I think, a little bit more.
Yeah, that was pretty eye-opening. Obviously, yeah, with only having one doctor is pretty crazy to think about. Just now, like, you've been in the field for so long and you've made such a big impact, but I'm just curious, what do you think the future of the healthcare field holds in like the next 5 or 10 years, or just for the foreseeable future?
Woo! That's an incredibly astute question. So you heard it from me, guys. Stock tip. Buy Amazon stock. Buy Google. Buy Apple. So I think the biggest changes that we're going to have, hopefully over the next few years, one, I think we're going to finally realize that health and healthcare does not occur within the actual clinic or hospital or doctor's office. I think that's the main thing. Hopefully we'll continue to have medical advances like COVID vaccines and magic pills that we can take to cure all kinds of diseases. But I think that things will open up in terms of where you receive those things. And again, most importantly, I think we'll come to really understand and internalize how a lot of what we see in the clinic in terms of disease and illness is actually a manifestation of where we live and how we live and the nature of our community, our food, our environment, whether or not we're exposed to stress, whether or not we're able to move and be active. And so this is why I said buy stock in Google and Apple, because these people have realized how much money there is in healthcare. Oh, it's trillions. There's really no other way they can get more margin other than by focusing on healthcare. So Apple has said that within a few years, you'll know them as a health company and not a watch company or a iPod. Who's even heard of an iPod these days? That was so 2000, So things will be democratized and people will start to get their healthcare from Amazon. You're already able to get your healthcare at CVS, for goodness sakes. And so I think that this lockhold that the health care delivery system has on healthcare will break up and people will start to take more control of their own health and health status. And again, on the equity side, I hope we will start to correct correct some of those societal living conditions that have made the disparities that we see. It's not so much that, you know, Black people, people of color, poor people just don't know how to take care of themselves. It's that they're living in conditions that are not conducive to good health. And so maybe Google and Apple and all those people can solve those societal problems that we have been unable to solve over centuries, really. Is anybody buying Apple now? Do that later. Good luck. I can't afford Apple stock. I'm just stuck. I can't afford it. Maybe one day.
Yeah, so that's very enlightening. Like, yeah, I think that's a really cool way to look at it. Like these big companies coming in and supporting healthcare. You know, I never thought it would be like that because they're primarily just tech companies nowadays. But yeah, maybe that's what the future has to hold.
They don't figure it out.
Yeah. So, like, what advice do you have to rural students in NC who are attending the webinar today?
First of all, hats off to you for even having this on your radar screen. I mean, you guys are so sophisticated. I see your background that's in the RESTEM. I mean, just miles above where I was in my thinking, I think, at this point. So even the fact that you're willing to listen to me today or later on, if you play this back, hats off to you. You're already, you know, above the game, real mature, thinking about your future. I think that's awesome. What I will say to rural students is oftentimes due to the resources that are not invested in our communities, we lack exposure to a number of things. You know, there may not be a whole lot of companies in your town, may not be a whole lot of tech companies, or, you know, your parents may not be working for these, you know, they may have regular jobs like doctor, teacher, lawyer, you know, but work in factories, places that are available to us in rural areas. So what I found when I got out there, I just hadn't been exposed to a lot of stuff. And so that's where I say, you know, read, take advantage of opportunities that do come your way. A lot of things are set aside for people from rural backgrounds in terms of programs and things. So I did summer programs, you know, in science. I went out of my community to go to, you know, UNC and App State and, you know, places like that to get exposed to other science opportunities. I did summer programs outside of my community to expose me to different places, different fields. I did research programs that I didn't have access to in Lumberton. And so oftentimes, again, to get opportunities, we have to kind of say yes and go outside of our community. By the same token, I think that a lot of that is sort of changing, and they are trying to bring more opportunities to rural areas. Some of it may be remote or virtual, but the main thing is just say yes to as much as you can in terms of being exposed to things that might be consistent with your interests or passions. Mine happen to be science, but you may be, you know, something else. And that's fine. Pursue whatever it is. Try to get kind of outside of the boxes that you're in your community. Don't let what resources are in your community limit you in terms of what you're trying to pursue and be exposed to. But by the same token, I would say, don't lose sight though of the fact that there are a whole lot of people likely left behind in your community who may not have taken advantage of those opportunities. And I do think that we have an obligation to try to give back and to change those dynamics. And so, like, that's how I ended up practicing in Lumberton for most of my career, actually. I would go to Lumberton and see patients even from Raleigh when I moved there, because I know they still needed doctors in Lumberton. And so You know, if we don't give back to these communities, just real talk, these communities are dying out. I mean, the rural parts of the state tend to be what we call grayer, more older people there. And frankly, they're just struggling to make it. And so if we don't give back, I think we'll have even more disparities between rural and urban areas in terms of opportunities. I don't know if we can jump in and answer this question, but I do see a question in the chat about my role at Reynolds Charitable Fund. I'm happy to answer that question unless you want me to go on with your next one.
Yeah, you can go ahead. Yeah.
Awesome. Well, that may have been my assistant who asked me that question, because I always like to talk about my current work. So this is actually in keeping with what I was just talking about. Growing up, I couldn't have told you what philanthropy was or a foundation was if my life depended on it. I didn't know anything about this thing that I'm now doing that is my dream job. I thought I wanted to be a doctor, and I am still a doctor. I want that. I'm always going to be a doctor, but that's not what I do on a day-to-day basis. I work for the Kate B. Reynolds Charitable Trust, which is a foundation, a healthcare foundation that basically gives away money for a living. I will say that again. I give away money for a living. Who knew? So 75 years ago, this year, this is our 75th year, in 1947, Ms. Catherine Reynolds is the wife of William Neal Reynolds. Now, you guys have heard the name Reynolds before, super rich people. You may have heard of R.J. Reynolds before. That's a big tobacco company. Work with me here. I know Dr. R.J. Reynolds. What's the connection? The connection is R.J. Reynolds, big tobacco company, brother of R.J., William Neal, big tobacco executive, a lot of money. His wife has a lot of money. She dies, leaves some of her money, ironically, to improve health around the state for people who are poor. And since she lived in Forsyth County or Winston-Salem, North Carolina, she specifically also asked us to help the people in Forsyth County who are living in poverty, improve their quality of life. So she leaves about $5 million equivalent in 1947. Says it's tied to the success of the R.J. Reynolds Tobacco Company. Says you can't sell the stock. Well, the company gets taken over hostilely by a European group or something. And so they had to sell the stock. And so overnight, roughly, her investment goes up to $500 million. So basically, there's over $500 million now in the bank at Wells Fargo. And that money makes money every year. It grows. We're up now to, well, don't ask me now because stocks doing whatever. But let's just say there's $500 million in the bank, and that money grows every year. And so what you do is you take the interest from that growth, 5% roughly, and we have to invest that every year to improve health around the state and to improve quality of life for people in Forsyth County. And that amounts to about roughly $20 million a year that we give away in grants, about $15 million to improve health around the state, and about $5 million locally in Forsyth County. And as the president of the trust, that's my job. I get to help set strategic direction for how that money will be spent. What is the best way to improve health for people who are experiencing poverty? And I also get to build the team of people that we work with who will do that for a living. And we get to do some really great things with that money. For example, we noticed that rural communities had much less investment in them on the health side than urban communities. So most of our money, at times up to 85%, of the grants that we're doing in health improvement, we give out in rural communities. So we give money to Beaufort County, Edgecombe County, Nash County, Columbus, Robeson, Bladen County, out west, McDowell, Burke. I don't know if any of you guys are from any of these areas, but those are the kind of places that we invest in. And we do everything that you can imagine, from literally investing in hospitals and giving hospitals money in order to help stay afloat, to investing in programs like home visiting programs, or some of the neater stuff that we're doing is investing in ways to address equity. So for example, we're helping to build grassroots organizations in a lot of these communities in neighborhoods like mine that were on the wrong side of the railroad tracks, that didn't have any organizations other than like churches and Girl Scout troops. And we're helping to build nonprofits in these communities to help people who are poor have more of a voice in their community, and to use their power to fight for things that are right, like Medicaid expansion, like pre-K for all kids. And those are the kind of things we fight for. So I get to do those things that I saw were needed in the clinic, but I couldn't really do as a doctor because I was busy seeing patients and prescribing medicine, and all that stuff that doctors do. But I get to work on those things, not only in the communities like where I live, but also around the whole state. And that means that I basically have the best job in North Carolina. I'm very popular at parties because we give away a lot of money.
That was a great answer. I think especially the strategic direction of not just dumping money, but also empowering people within these areas to create change themselves in the way that they think that they need to change their situation is really remarkable. And it's obviously a culmination of all your experiences. I got sent a question about what is maybe a common misconception about the healthcare field or about being a doctor.
Okay, and thanks for the shout out there in the chat too. Someone's thinking. I had this idea of wanting to get through medical school and residency, and I did not think so much about what the practice of medicine is actually like. And mind you, I enjoyed it. I don't want to misrepresent the field. It's a very rewarding field. I enjoyed the patient interaction. I enjoyed the family interaction. So as a pediatrician, a lot of our children were too young to even speak. And so, I had to get most of my information from parents or caregivers. And I enjoyed that one-on-one interaction. But I think what we don't so much understand is how that can become very routine and sort of mundane, if you will. And more specifically, how little time in most medical practices you have right now to devote to that. I think a lot of people enter the field thinking, oh, great, I'm going to help people. It's like going to medicine, But the reality is the role of the physician, you're really a scientist. And so, you heard my story. I started from a love of science. And so good thing, because if you're going into medicine without that love of science, you're going to have a rough road to hoe, because you are essentially, you're trying to solve a problem. You're there to figure out what's wrong with the patient and to assign the right treatment. And so you don't have so much time for the things that you may have thought you went into medicine for, talking to patients. And, you're paid to think, and you're paid to think very quickly so that we can get to an answer. and somebody else is going to be talking to the patient, the nurse, or somebody else. You don't do a whole lot of that, and that can be disconcerting for folks to realize how little time you actually have to spend with patients, and how much you're supposed to accomplish within that period of time. And then the other thing that can just be sort of disconcerting is just the whole pace and quantity of it all. I think that they're changing that now. But I trained in old school, medicine, where we were on 24 hours a day, and you may discount how tough it is to be your best when you've been up for 36 hours, and so the magnitude of it can be really quite draining. But like I said, I think a lot of that has been improved, but I don't think I knew exactly how exhausting it would be, and how difficult it would be to stay, even to remain as giving and as helpful as you might want to be, because you're just stressed and tired. And so burnout is a big issue for people in medicine, even today, with some of the improvements that folks have. Looks like folks might want to know a little bit more about Reynolds. I appreciate the shout out there for folks saying how interesting it is to hear about philanthropy, but it's a really interesting field. We have some internships that folks do often in college at foundations and philanthropies and nonprofits. It might be something you want to do, because frankly, these days, if you just really want to help people, there's a whole lot that you can do, including nonprofit work. It doesn't all have to be medicine and health, although of course I encourage you to do that if that's what you want to do.
Yeah, so another question that was received, just, and doesn't just have to be like healthcare, but in general, like, what would you say, like, what's your biggest advice, career advice you would give to anybody who's on this webinar right now?
Awesome. Thank you for that question. That is really one of the main reasons I always like to talk to young people at early stages of their career, because the reality is, especially if you're on this webinar and doing this, you're gonna have a bright future with a whole lot of things available to you in terms of a career. And so I will give you advice that I got in my public health training from one of my mentors. And mind you, to set the stage, I had been practicing for 3 years in Lumberton. I knew that I wanted to work on a more population level, a bigger picture level than the individual patient level, because we didn't get into the problems that we're in one at a time. We got into them at a population level. All Black people were denied certain opportunities. Immigrants were denied certain opportunities. People of color denied opportunities as a group. But yet we're supposed to get out of it like one at a time, just make a better health decision, one at a time, just, pick yourself up by your bootstraps and get an education. And so I was doing that one at a time thing and knew, no, that's not it. I want to work at a population level. So I went to get my master's in public health. I didn't know. So for the first time in my life, I didn't have the next 10 years already mapped out for me. In medical school, you got 10 years mapped out, 4 years medical school, 3 years of residency, plus more if you're going to do a specialty. And then you got to, So I was like, holy cow, well, now what am I supposed to do? And I was kind of freaking out. Because I had a year to figure out something. And my mentor said, it doesn't matter what you do. Don't worry so much about what you will do. Focus on what you are about. Say that again. It doesn't matter what you do. Focus on what you are about. And so that's where I had to just dig deep and really ask myself, what is it that I'm trying to impact, basically? And I knew for me, it was about improving health for vulnerable populations. And, you know, that for me included children, poor people, people of color, people who had been denied access. I knew that was going to be my wheelhouse and health was going to be my area. So then I was able to evaluate a number of opportunities against that sort of basic backdrop. And I ended up, you know, having opportunities beyond my wildest dreams. Stuff I didn't even know I wanted to do. That's how, when I saw the people in philanthropy who were working on all these different things, oh, I did a little bit of social determinants here, going to help some hospitals over there. And I was like, wow, that looks cool, but I hadn't even ever thought about that before. But I was like, wow, that's a real good way to help poor people improve their health, you know, and the state health director. I mean, we didn't even get into that. Thank God I'm not doing that now because of COVID. But, you know, running the public health system for the state, that was a major way to improve health. And then I did this consulting thing where I was going around the country working with hospital systems. And so it just opened up a whole lot of possibility for me. And so, you know, even now, I hope I retire from this. That's my goal. But if I didn't, if I lost this job or whatever, I know that there are a whole lot of things I can do if I just want to improve health for poor people. So it just opens up so many more possibilities for you if you don't get so locked in to, oh, I've got to do this particular job. Let's be happy.
Yeah, thank you for that response. I think like a lot of people can take that advice, you know, it's about doing what you are about. And yeah, I think that was really great advice that you gave. So yeah, I mean, we are unfortunately running out of time, but I would like to thank you, Dr. Gerald, and also Miss Yates, and everyone that helped out this webinar today. And I hope Dr. Gerald's story like inspired everyone today. I know it at least inspired me today. I got to learn a lot more about your story, which was really nice. We will also put a feedback form in the chat right now. This is completely anonymous, so all feedback, yeah, all feedback is greatly appreciated. Let me see if it's posted. Yeah, okay, yeah, the form is in the chat, so if you guys could do that, we would really appreciate it. And before we leave, Dr. Gerald, do you have any closing remarks?
Yes, Erin's gonna hate me for this. She's my she's my special assistant, but I really do wish you all the best. And Big On knows I am accessible, happy to answer any questions. I'm laura@kbr.org. If folks have other questions or things, we're happy to, seriously, Erin, we're happy to try to answer them. Again, we need you guys. We need young people. We need young people who want to do good things. And I truly, truly do wish you all the best. I'm sure that you will succeed beyond your wildest dreams.
Thank you so much for taking the time to speak with us all today and share your story and experiences. It's been great.
Thanks so much. Appreciate the invitation. You guys take care. Bye-bye.
Thank you, everyone.